Good morning, everyone. I'm Diane Perez, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Patterns and Trends of Substance Use Within and Across the Regions of Florida. This webinar is being made available through a collaboration of the Florida Department of Children and Families Office of Substance Abuse and Mental Health and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you may have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options will be posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 10 business days. To access the recording, go to www.fada.org. Also, a PDF version of this PowerPoint presentation will be emailed to participants. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FADA as part of registering remains confidential. Statements of credit will be posted within 10 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close at midnight on Thursday, March 21st. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you don't need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrival and departure of attendees and provides a report upon completion of the event. We are not permitted to provide contact hours or a certificate of attendance. If you do not attend the entire webinar, we are not permitted to provide partial credit. I would like to introduce our instructor, Dr. Chen. He is a professor of epidemiology. He received his doctorate in preventative medicine from Wuhan Medical College, China in 1982, and doctorate in biostatistics epidemiology from University of Hawaii in 1993. Dr. Chen is an established behavioral epidemiologist His research has primarily focused on the epidemiology of health, risk behavior, and behavioral prevention intervention for risk reduction, advanced statistical analysis, linear and nonlinear system modeling, transdisciplinary and international collaboration in cross-cultural perspective characterized much of his research. After receiving his doctorate, he spent approximately 6 years at the University of Southern California with research focusing on tobacco use and prevention among adolescents in the United States and China, with secured funding from the National Institute of Health and the state of California. In addition to his scientific contributions, he initiated and established through teamwork a solid and long-lasting collaborative United States-China relationship. Before joining the University of Florida in January 2014, he spent more than 10 years at Wayne State University with continuous NIH funding. Dr. Chen brings 2 ongoing NIH-funded projects with him. One was devised to investigate social capital and its relationship with HIV risk behaviors among rural to urban migrants in China, and another was created to test and establish the catastrophe modeling method for analyzing HIV risk behavior in adolescents. I also would like to introduce Mike Swain. He is the doctoral student in the Department of Epidemiology at the University of Florida. Previously, Mike earned a master's degree in public health from the George Washington University, where he conducted academic work developing opioid policy solutions for a rural Michigan Health Department. Mike currently works in evaluation for the University of Florida and has also worked for local health departments in policy and communications realms. And now I'd like to welcome our presenters, Dr. Chen and Mike Swain. I will turn the presentation over to you.
Okay, scroll down. Oh,
there it goes. Hi, everybody. My name is Mike Swain, and I am, as was mentioned, a PhD student in the Department of Epidemiology here at the University of Florida. And I'll also be presenting with Dr. Chen, who developed this work, and we will be splitting up the presentation here. And I'm going to go over objectives first and an overview of the presentation, and then Dr. Chen will start into some of the material. So we developed a few learning objectives that we hope you're able to get out of this presentation today. And this includes 3 things. First, understanding current trends in substance use among both youth and adults in Florida, and also becoming aware of differences in these rates between the 7 managing entity regions, and then finally learning about how these trends may inform, how this data may inform substance use prevention and treatment work. So we're going to have several sections here. After the introduction, Dr. Chen will move on to covering alcohol and tobacco use. I will cover marijuana use in addition to psychoactive substance use and opioids. And then Dr. Chen is going to cover the rest of these sections, which are on the next slide. And we'll also go over some takeaway points at the end to meet that 3rd learning objective. So this slide describes the data that we used in developing these trends. So we used both national and state level data. We use national data when comparing Florida rates to rates from the rest of the United States, so it was consistent. And these data sources include the Youth Risk Behavior Surveillance System. You'll see the acronyms here, and you'll see them throughout the slides. The Behavioral Risk Factor Surveillance System. Both of these data sets are operated by the CDC. And then the National Survey on Drug Use and Health, which is the data set developed by SAMHSA. for data we use from the state of Florida, in this, we use data from Florida to compare rates within the state. So gender, grade levels, things like that by regional entity. We use more detailed state level data, and this includes some demographic data that we'll go over in a second here through the Bureau of Economic Research here at the University of Florida, and then Florida Youth Substance Abuse Survey, and then also annual reports from the Florida Medical Examiners. So for some of the demographic data, it will be important to keep in mind when we start comparing regional differences. Here is a map of Florida with population density. You'll see the lighter shades are less populated counties, where the darker shades are more populated, so more populated on the coast, less populated in the Panhandle area. And then we'll move on to the next slide using that same type of legend with percentages, looking at the proportion of Black residents per county. So you see in the darker red shades a higher proportion of Black residents in the Panhandle, and then Duval, Alachua, Orange, St. Lucie, and Broward counties, whereas the lighter shades have a lower proportion of Black residents. Looking at the proportion of Hispanic residents in each county, you see the darker red shades signifying a higher proportion, over 20% of the county's population is Hispanic. You see that a lot in South Florida, starting from Seminole and Orange County south, where it's less than 7% in the counties in the Panhandle, a lot of the counties in the Panhandle. In the next slide, we're looking at youth population, which is defined as 17 and under, so the percentage of residents or people in a county that are 17 and younger. Two counties that are over 25% in this realm are Hardy and Hendry counties. And then you see lower rates in the lighter shades, less than 15% in Citrus, Sumter, Sarasota, and Charlotte and Monroe counties. And then kind of varying between the 15 and 25% intervals the rest of the state. And these are just important things to keep in mind when we start comparing differences by entities, the makeup of the populations in these entities. Next is a slide of the managing entities. So the colors obviously represent the 7 managing entities, whereas the breaks in the counties just represent geographical regions, so Northwest, Northeast, Central. And you can kind of see how these, as I'm sure you're aware, how these regions, the entities overlap several different types of regions. Next is a simple pie chart of how many people, or the population of, in number of people in each managing entity region. So we see that the Central Florida Cares Health System has a very large percentage of people that live in that region, where the Big Bend community-based care region is the smallest, but also have a large number of counties. So this pie chart simply represents the number of people in each region. Also something to keep in mind as we start looking at data by region. And this slide just describes what I was saying earlier about the differences. 3 managing entity regions cover 61% of Florida's total population, while the other 4 cover the remaining population of about 39%. And now I'm going to turn it over to Dr. Chen to discuss some of these trends, starting with alcohol use.
Thank you, Mike, for the very nice introduction. Now I'm going to talk about alcohol use and tobacco before we have a break. And okay, alcohol is main focus of substance use prevention among adolescents. And so in this time we're going to talk about underage drinking and binge drinking. And also underage binge drinking by managed entity regions. We're going to cover a little bit about adult drinking. And as you all of you may aware, when we measure alcohol, any substance use, we use a couple of commonly used indicators. The first one is we call a lifetime use. Lifetime use, the term is kind of sometimes confusing, like somebody use every day through the whole lifetime. Actually, it's not. It asks, if a person ever used in their life, which provide information regarding, how many kids already started using. And it's a kind of earlier, indicator for alarming information. The second indicator is, the age when they first used. We call age onset or initiation. If more kids initially the substance earlier, then there will be alarm settings, so we need to be more careful. If they onset later, that means our worker may achieve some good results. The third and most commonly used indicator is we call it past 30-day use. We also use this as the current use. So different people use different terms. That is the commonly accepted measure to see how many people are using now. So we use, to be exact, we call it past 30-day use. So just some brush up before I move to the detailed data. First, we want to see how the adolescents in Florida doing in terms of alcohol use compared with national trend. This slide, we plot the data from NSDH, National Center on Drug Use and Health. And here, the bottom line is the year of the survey, from 2006 to 2017. The vertical bar on the left-hand side is the rate of past 30-day alcohol use. This is for the adolescent 12 to 17 years of age. In the chart, we have two lines. The blue line is for Florida, the red line is for the national average. Also, you'll notice the dot of the national and Florida, a lot of line up is like about 1 year apart. This is because the national rate, they compute the rate for every year. But when they compute the rate for each state, since each state only have a small number of people in their survey, so they average 2 years to get a stable, to get a good estimate. So the Florida, the blue line, that Florida is always between the national yen way to measure the trend. But this difference, don't affect us to make a comparisons. So from the chart, you can see overall, the Florida kids compared with the national, we are similar. We are not really better off. Very much follow the national trend. And the last year the last two data points from 2015, 2016 in Florida, the blue line, we have an increase from 9.2% in 2015, 2016 to 9.9% in 2016, 2017, and which still similar the national levels, but we have increase in trend over there, which seems quicker than what about the national levels. So from this chart, you can see from the previous chart, you can see the currently alcohol use in Florida similar to the national average. This is the whole overall conclusions. What do we mean? Continuous decline, which is a good sign. But we do see a small increase from 2015 to 2017, which we need to watch out. 19. Okay. No, this is correct. Okay, the next slide compare with the so-called more sensitive topic, the lifetime alcohol use. Also compared with Florida with the nation, but this time we use data from the youth risk behavior surveys. Here the same in the bottom, the x-axis with the bottom is the EF survey. The left side, the vertical bar is the percentage of lifetime drinking. And they also there's two lines in the chart. The line on the top is for the nation as a whole. The line next to the kind of a shady line, weak line, will be the data for Florida. Now you see the from 2005 to 2015, there's no data for Florida, but we have data for national because the youth risk behavior survey do not provide data for our state during this period. But this do not affect us to compare our trend with national trend. Because this is, as I said in the beginning, this is a very sensitive indicator. If it increases, that means more cases are going to use alcohol later. So from here you can see also the alcohol use before 2018. There's a kind of stagger over there. After 2007, there's a quick decline, but after 2013, the decline even speed up with the national trend. And for kids in Florida, we follow the national trend. By 2017, the lifetime alcohol use rate actually for Florida use is lower than the national average. We were 56.5 for high school students in Florida, but 60.4 for the nation. We can not say we're going to renege, but still very high, but we do better than national average. This is just a summary about the previous slides. The lifetime use continue to decline, and we are still lower than national average. Thank you guys for the good job. Now we turn to the data regarding the age onset. The first is data with like a lifetime use, which is more general, but age onset will be more specific. And we use the data from the youth risk behavior surveys for high school students, because in middle school the rate is very low, so we use the high school, which get more reliable data. And the same thing, like the bottom will be the year of survey. We start with the 2005 till 2017. The left, vertical bar will be the rate of initiation by age 13, because 13 is a very critical time when the youth start puberty and they become more crazy. And this is the definition of youth in the age 13. Here the same thing, we have two lines on the chart. The blue line is for Florida, the red line is for national. You can see we were quick decline in age onset since like 2011. No, you quick decline in the national. But after 2015, there's an increase in the age onset for Florida adolescents compared with the continued decline in the national rate. By year 2017, 16.8% of Florida high school students initiated alcohol use by age 13, but the same rate for the nation only 15.5. And this is what we need to pay attention to. A quick summary of the previous slides. So, alcohol use by age 13 in Florida, the trend is similar to the national, so-called continue to decline. If you think about the overall mega trend, but from 2015 to 17, there's an increasing trend. So all of us need to pay attention to watch this earlier onset. When they onset earlier, then they're more likely to increase later for post-surgery use. Differences. Now I'm going to talk about between managed entity region differences regarding alcohol use. So we can talk about lifetime use in the past 30 days, and the binge drinking. I think this is the most important three pieces of data for us to make a comparison across the managed entity regions. This slide shows the cross-region rate of alcohol use by gender and total and by gender for the whole state and for each managing entity regions. This chart is kind of a little bit crowded. On the left-hand side, the vertical bar will be the percentage of use, lifetime use. The bottom will be the first three bars for the Florida state as a whole. Then we have the 7 entity regions, like a Big Bend and the Big Broad. It's different regions. So overall, based on our own data, not national, for adolescents in 2018, we were 35 of the kids reported they use alcohol, and there's a wide gap in between male and females. So 34.1% boys say the male they say they report they use, but 38.9 females report use. This is the state in 2018. And now if we compare each management entity with the region by looking into their dark brown bar on the leftmost side, there will be 66.5. So anyone higher than this will be higher rate, and lower than this will be lower rate. So you can see with this on mind, we have several entity regions with a higher rate, like the Southeast Florida with a 38.7, the last bar on the right, and also we have one like North Rim with a 66 point, slightly higher than the state national average, ISF. Also we have the Central Florida behavior has network system 66.8, which is also higher than the national. But we do have several regions with the lower rate than the national, 34.6 will be the lowest one, which is for Central Florida Care Health System, and so this is the compare with each region with the state average. We also see gender differences. You can see if we statewide we see the females are more likely, or the girls more likely than boys to use alcohol. This is for statewide 34.4 compared with 38.9. This pattern is true for all the entity regions with different. The difference are not the same, but some with a huge difference. For South Florida Behavioral Health Network, the alcohol use rate for boys 30.6, but for girls 41.7. So as a summary of the data we see in the previous slides, overall the lifetime use is not very big across the managed entity regions. The range is 35 to 39 if you round up. But the girls are really more likely than boys to drink in all the regions across the board. And particularly South Florida, we already see that the South Florida Behavioral Health System with the largest differences. This I see we really want you to get this data and to see what should we do to improve later. Next, we're going to talk about post-facility alcohol use. Also for the state, also do a cross-region comparison. This chart will have the same setting. The bottom will be different, starting with the Florida state, then different managed regions. The vertical bar will be the rate of post-facility alcohol use or current alcohol use. Overall, we have 15.3% of use in Florida reported use alcohol, which is to me is not that scary, but it's high. Also here, we also say gender differences. Girls are more likely than boys to use alcohol in the past 3 days statewide. So for boys, only 13.8% say they use alcohol in the past 30 days. Girls say the 16.8% of girls say they use alcohol in the past 30 days. And if we want to see the difference across regions, also compare with the 15.3 on the most left side bar for the state. Any number greater than this one for your own region will be more, more drinking, more use drinking, or lower than there will be even less use drinking alcohol in the past 30 days. From here we can see several states with very high rate, like the BBCDC 16.9 is kind of higher than the 15.3, and the more others like the north will be 13.1 for BBHC, and so this give us the information about the overall comparison. And here we also see a big gender differences by comparing the red bar with the light brown bar, and the statewide gender difference. Managed entity in each managed entity we also have the gender differences. So that is something consistent with the lifetime use. Now the summary about past-30 alcohol use. We do see a larger difference in past-30 use than the lifetime use across the managed entity regions, ranging from 13% to 17%. The girls are more likely than boys to drink in all managed entity regions, particularly the SFBHN 18 versus 13. Now let's go to the binge drinking, which is the most hazardous drinking. If the kids just drink a little bit, it's okay, but if they do binge drinking, they must have some reason behind making them want to expose themselves, use alcohol. And the same pattern of the chart, the bottom will be the first three bars will be for the state, the rest will be for each of the entity regions, and the most left bar will be for the overall. The red is for boys and the light brown for girls. The vertical side on the left will be the percentage rate of binge drinking. And the overall 6.8% of youth in Florida reported they have engaged in binge drinking in the past 30 days, which kind of, from my experience, is high because like about 1 in 10 something, in the mark, because 6.8 like 7, and the kids may not fully declare they did, they may forget. So it is something we also need to be aware of. Compared with the we see like a large difference across the managed entity regions with regarding binge drinking. Like South Florida behave has not okay. Kids in this region have a very high rate of binge drinking, 8.8%, and when the BBHC was the lower rate of 5.8, and however here the gender pattern switched. Boys are more likely than girls to engage in binge drinking for the Florida state overall, also in let me see, in most of the regions, but with 2 exceptions, 3 exceptions. Now LSF, SF, BHN, the last 3 will be reversed. So girls are more likely than boys to engage in binge drinking. That's something we want you to keep in mind what this information tells us about. So there's a summary regarding the previous slide regarding binge drinking by managed entity regions. Relative to the 30-day drinking and binge drinking difference, kind of smaller, so we say 6% to 9%. But girls still more likely than boys to binge drinking in several entity regions, not all of them. That's what we need to correct. Let me check. Yeah, this will be. See. Yeah, this one should be girls were more likely than boys to engage in binge drinking in most of the managed entity regions. Sorry for the incorrect message over here. So in most, not all of them. That will be information for adolescent alcohol use. Now we're going to touch a bit about adult alcohol use in Florida because the information we think also useful. We're going to just tell you just a personal something on past 30-day use and binge drinking because lifetime use for adults provide no information because they really pass the time to develop drinking behaviors. This chart shows the past 30-day drinking for the United States and Florida, and for a period from 2006 to 2016, with data from the behavioral risk factor surveillance system. This is a nationwide survey. Many of you may be very familiar with, and they conduct a survey every other year. So we have that data over here. So the bottom line will be the year of survey. The vertical line on the left side will be the rate of past 30-day drinking, and the green lines for Florida, the red lines for the USA as overall. So you can see in the past, more than 10 years, the 30-day alcohol use in the nation and in Florida was kind of a flat, like 52, 53 in the range. In Florida, we have before 2010 we get an increased trend, but afterward the rate continued to decline. In 2016, the rate in Florida actually was lower than the national average. In Florida, we have the last point on the line. In Florida, we have 52.7% of adults reported use alcohol in the past 30 days, but in the nation, we have 53.5. Do not think the difference is small. It's small because the population size is big, so they indicate enough more adults use alcohol nationally, but we have fewer in Florida. Okay, now let's move to binge drinking in the past 30 days. Here we use the blue line to show Florida, the red line for the national average, and also from the same period from 2006 to 2016. The new data for 2017 has not been available, was not available when we prepared the report, but we're there to 2016. And you can see here also with regarding binge drinking, Florida kept doing better than the national because we're always below the national rate. But we did a steady increase in 2012, and then we make it go down quicker than the national average. Till 2016, we have a lower rate of binge drinking among adults in Florida than the national. In Florida, only have 15.5% of adults reported binge drinking, and 16.9% of all the adults in the states. In the U.S., they reported binge drinking. So overall, the drinking behavior among adults relatively stable nationwide and in Florida. And Florida actually do better than the national average. Okay, this is about the alcohol use. Now I'm going to switch gear to tobacco. Yeah. Tobacco is what I did my research at the very beginning when I came into the United States. In this talk, we're going to talk about both combustible or conventional cigarettes most of us are familiar with, Also the electronic cigarettes, which just pop up in recent 5 or 6 years, and the first we're going to talk about the traditional cigarettes combustion. This is like a background information for us, and we want to see how since changing over time, they compete with the electronic cigarettes. So we're going to talk about the lifetime use for national comparison, and talk about past 30-day use of smoking by managed entity regions. In this chart, we show the lifetime cigarettes, the conventional cigarettes or combustible cigarettes among high school students, Florida versus United States, which is high school students, because data only available for high school students for comparison, even though they have other data. And here you can see the same pattern of the slide. The bottom line will be the year of survey. The vertical line will be the rate of lifetime cigarette smoking. The blue line is for Florida. The red line is for national. And also there's some data point missing because the use risk because survey do not provide data for Florida for this period. Overall, this chart is easy to follow. The national is the lifetime cigarette smoking going down, quickly. There's a little bit like a staggering between 2011 and 2013, then start to decline again. For Florida, we do not have detailed data for in between, but we have a quicker decline than the national average. Till 2017, 28.9% of high school students in the nation reported lifetime cigarette smoking. Only 18.6% of high school students reported lifetime smoking in Florida. Just a recap of the previous slides, lifetime smoking rate, this about cigarettes, continue to decline in Florida as in the nation. The rate of cigarette smoking among youth in Florida actually lower than the nation in 2017. Now we turn to the past 30-day cigarette smoking. This is for all the youth from 12 to 20 in Florida. So when you see the numbers, you have to think about the denominators. Previously, we talk about high school students, which has a higher rate. Now we just talk about with youngsters, including the sample, the overall rate is going down. And here also we have the same pattern of the state. Overall state will on the left 3 bars, and the rest of 7 will be for managed entity regions. The vertical bar talk about the rate of past 30-day smoking. So you can see the statewide, we only have 2.5% of kids reported use conventional cigarettes. That is in the past 30 days, which is very low. Among 100, only 2.5 kids, 2.5 kids say they use. And there's some gender statewide on the left 3 bars. Some gender differences, like girls are studying more likely than boys to report smoking in the past 3 days, with 2.6% compared to 2.4%. This is the statewide average. But if you compare the same rate across the 7 managed entity regions, we see dramatic differences. With the BBCBC, they really like about almost double the state levels. The second will be North Rim LSF, and with 3.4%. And we also have several managed regions with the rate below the state, way below the state average, like BBHC with 1.3%, and with huge regional differences. We also see some gender differences, like for BBCBC, boys are more likely than girls to smoke in past 30 days. But in most about Southeast Florida Behavioral Health Network, girls are twice more than boys to smoking the conventional cigarettes in the past months. So just a recap of the possibility of cigarette smoking in Florida. So overall, the rate is low, from 1 to 4%, with 2.5 statewide, but we do see a large variation across many energy regions. That is something which all of us need to pay attention to. It is both a challenge, also a potential to improve. We'll also provide new data for all of you regarding the possibility of cigarette smoking among adults. So this chart, we use the data from the behavior risk surveillance data for a period from 2006 all the way to 2016. With the blue line show the data for Florida, the red line for the national average, and the northern line, kind of a zigzag, and with overall in the past 12 years, there's an increase from before from 2010 to 2011, but after 2011, both national and Florida trend kept going down, and there is the adult smoking, which is a good sign. But only in 2014, the Florida rate higher than the national. After if we forget about that point, for the rate of adult cigarette smoking always lower in Florida than the nation. And by 2016, 15.5% of Florida adults smoked cigarettes in the past 30 days, compared with the 16.3% for all the adults in the United States. And so we do better to reduce tobacco use among adults in Florida than in the nation as a whole. So this is just a recap of the previous slides. Nothing. Now let's move to electronic cigarette use. We also talk about more focus on adolescent use with a little bit taste about adult use. This slide shows the possibility use of electronic cigarettes among youth in Florida with data from our own survey, Florida Youth Substance Abuse Survey. And we give us information on lifetime use on the left two bars, and the possibility use, the second set of bars. Then the third one compare male and the female differences. And we also lastly compare middle school and high school. The red one is for 2018, the blue one is for 2016. So we want to see how the e-cigarettes use changes in our state. So overall, we have an increased trend in lifetime use. The first the left two bars, the blue and red, indicate in 2016 we have 25.8% use reported lifetime use, but in 2018 we have 27.1%. So there's an increased trend in terms of lifetime use. Now the second two bars, past 30 days use, we even see a bigger increase in past 30 days use. In 2016, we only have 6.9% use e-cigarettes in the past 30 days. But in 2018, this really increased to 13.7. And we see increase from both boys, male, 10.6 to 14%, and more for girls, from 8.4% to 13.5%. We also see the increase in middle school kids, in high school kids. For sure, high school kids with more increase from 12.8 to 90.2%. So this information is very useful for all of us. So this is just a summary about the previous slide. See how the things are changing. I believe you get the point. Let's move to the next slide. This is a e-cigarettes used in the past days. compared by the managed entity regions in 2018. Overall, if you look, the dark brown bar for all the 8 bars on the left-hand side, the first set is for state, and the rest will be for each entity region. So statewide, we have 13.7% of use. Use the e-cigarettes in the past 30 days. And we do see now several regions higher than the state average, with the CF, the Central Florida behavior has no with the highest 15.8%, and with the BBHC with the lowest rate of 11.1. And we do also see gender difference. Boys are more likely than girls to use e-cigarettes in past 30 days in most of the regions, with a few exceptions. For Central Florida, care health system, the rate for boys are lower than the rate for girls, 12.1% compared to 12.7% in CFCHS. Yeah, just a summary about the electronic cigarettes among use in the past 30 days. So far, we have 13%, about 14%, 13.7%, and we have 3 managed entity regions with higher rate: Big Bend and Central Florida and Southeast Florida. And when managed with the lowest rate is the broad behavioral with the low rate 11.1%. Now I'll give you some information regarding e-cigarette use among adults. Relatively, adults are not they're crazy for the e-cigarettes, but we still have somebody who use the e-cigarettes among adults. So this is a slide for the lifetime use in the past 30 years, compare Florida with the USA as a whole. So the never bar, the vertical bar on the never will be the rate of use. So we have lifetime use. The blue will be for Florida, the red will be for USA, and the past 30 is a small bar on the right-hand side. So you can see overall, the lifetime use rate is it's kind of a moderate, but the 30-day past 30 use is very low, less than 5%. And so in a way, adults in Florida actually in many places are not crazy for electronic cigarettes, but we do some data from my own research to see in some areas the electronic cigarettes is also gain popularity among adults. So I think I finished the talk about alcohol and tobacco. I think it's time for us to have a break. Yes? Hello?
Hello. We'll go ahead and take that 5-minute break.
Okay. Yeah. We are watching the time. We have 5 minutes break, and then we'll
be back at 10:50.
We'll start with at 11.
57. 5 minutes.
Yeah. Yeah. Let me do that.
Hi, this is Mike. Is now a good time to start?
Hello, Mike. Yes.
Okay. All right, so I'm going to cover marijuana use and trends in that regard in Florida compared to the rest of the country, and also breaking that down into youth and adult use, and then differences between the managing entity regions, and then also talk a little bit about trends in synthetic marijuana use. Obviously, there's been big policy changes in marijuana use in Florida and the rest of the country over the last several years, so you see some of that reflected perhaps in the trends. And again, we'll be using several variables when looking at this, such as past 30-day use, lifetime use, and age of use onset. So just keep that in mind when you're looking at these different trends. They represent different questions that the participants or the respondents of these surveys are being asked. So start off here with lifetime use among high school students in Florida versus the rest of the U.S. This is one of the data sets from CDC, the Youth Risk Behavior Survey. The bottom axis shows the years, while the vertical axis shows the lifetime marijuana use percentage. And you'll see fairly similar rates here between Florida and the rest of the country, with the most recent year of data, 2017, showing rates about a percentage point away from each other, with 35.6% of U.S. high school students reporting some type of marijuana use in their lifetime, with Florida students reporting 34.5%. But however, you do see a trend downward from 2011 in Florida, from 39.1% to 34.5%. Then overall, looking at it, you see a slower decline, however, because in 2007 the rate in Florida was 35%. In 2017 it was 34.5%. So it's a slower trend overall compared to the U.S., which went from 38.1% to 35.6%. So this next slide here will just summarize what I was saying. The long time trend in Florida is very similar to the national average for lifetime use among high school students, but slightly lower in lifetime use, and then a slower decline relative to the national trend. Next, we'll look at past 30-day marijuana use among 12 to 17-year-olds in Florida versus the rest of the U.S. And this data comes from SAMHSA. And as Dr. Chen had mentioned earlier, you will see the blue data points are midway in between the grid lines. And that's because for Florida, we combined 2 years of data to increase the sample size, where the U.S. rates are on the yearly lines. So going back to 2006, 2007, you see Florida with a slightly higher rate than the rest of the U.S., and then it has gone back and forth, overlapping until now, the most recent year of data, 2017, where Florida has, again, a higher rate of past 30-day marijuana use, about a percentage point higher than the rest of the U.S. at 7.5%. And so over time, you see the Florida rate has gone up, particularly in the last 2-3 years, since 2014 really, from 6.8% the year 2014-15 to 7.5% in the 2 years combined of 2016-2017. And then going back in time, that's an increase over the last 10 years, where the U.S. rate has remained fairly steady from 6.5% in 2006 to 6.6% in 2017. So that would be something to perhaps of concern, the increase in past 30-day use in the last few years. Whereas if we go back here, we can remember that we saw a decline in the lifetime use over the last few years, but an increase in past 30-day use. So this just summarizes the previous slide. Over time, the trend is somewhat similar to the national average, but there's been that continued increase over the past few years in Florida. Next, we will separate these out using state-level data, looking at the total rate over time of lifetime use, and then that separated by gender and the school level. So again, the vertical axis shows lifetime use percentage with the years on the bottom axis. So at the top line, high school lifetime marijuana use. You see again that trend downwards from about 2012, but it trended upward the previous couple of years. So over time, the past 10 years, it's slightly down from where it was, or from 2006 until 2018. And then going down to the bottom of the chart, you see middle school rates have declined slightly since the time period in this graph, from about 10% in 2006 to about 7% in 2000, 7.5% in 2018. And then interestingly, again, to the male-female differences, the green line represents females and the red line represents males. And you see male use going down starting in 2010, and it's gone down every year since then, or every year with data, from about 25% to about 20%. Meanwhile, the female rate has stayed about the same at about 22%. But compared from the beginning of this chart here, 2006, to now, females as of 2018 have higher use than males compared to the previous years of 2006 to about 2016, when those lines converge. And then finally, the total lifetime use, which we went over a little bit in previous slides, but somewhat of a downward trend since 2000. And again, this is among youth in Florida. So now we'll look at past 30-day use. And again, you see the one thing I want to point out first is the differences between males and females, since we were just talking about that. This is, again, males are in the red line and females in the green line. Males have been trending downward since 2010 in past 30-day marijuana use, where female use has not really changed over this time period. But however, males and females now report past 30-day marijuana use at about the same rate in 2018 compared to when males in previous years had used at a higher rate in the past 30 days, similar to lifetime use. And then overall, the black line in the middle, you see differences throughout the years, but from 2006 until 2018, the rate is about the same, and then perhaps slightly lower. And same thing goes for high school students. The rate is about the same in 2018 as it was in 2006. It's gone up and down since then, but the rate is nearly the same. And then for middle school students, the rate is slightly lower than it was in 2006 and 2018. We'll move on. Summarizing those previous slides, you see, as I mentioned, converging gender differences in past 30-day marijuana use, and then gender differences in lifetime use having crossed over in the years 2016 to 2018, where now girls are using marijuana at higher rates than boys, which is flipped from past years. Now we will look at differences between the managing entity regions, including the two variables of age of onset of use, and then use in the past 30 days. So this chart shows the different managing entities on the bottom, as well as in the bottom left, the state combined total. And then it looks at what percentage of youth initiated marijuana by age of 13. So we see overall 10.6% of males in Florida, youth males, report initiating marijuana by age of 13. Report initiating marijuana by 13 at a lower rate of 8% overall. And this gender difference, compared to the previous ones where males are initiating earlier, or the previous slide showed that the crossover with females using perhaps more past 30 days or lifetime, with males trending downward, males are still using at a higher rate for the initiation by age 13. So we see this holds true for each of the managing entity regions, except for the South Florida Behavioral Health Network, where females actually use at a much higher rate of about 10-11%, compared to males reporting initiation by age 13 as only 6%. And some of them, as you'll see here, of each of the 7, it differs in terms of the difference between males and females initiation at age 13. Some are closer together and some are farther apart, but 6 out of 7 of them all have higher male versus female rates. Next, we will look at the past 30-day marijuana use by youth in Florida, looking at gender and managing entity differences. The last slide, keep in mind, was the initiation by age 13. Now this is past 30-day use. So overall, again, managing entities are on the bottom and the rate is on the vertical axis. And the bottom left corner shows the state totals. So about 10.9% of youth in Florida report past 30-day marijuana use. And the gender differences are far less pronounced than they were in the previous slide with the initiation. Here, females report slightly higher past 30-day marijuana use at 11%, where males report 10.7%, the rate of past 30-day use among youth. Now, we see some differences between males, females, based on the managing entity region. We also see the brown bar represents the total. So looking at that first, you see the highest rate of past 30-day use in the Southeast Florida Behavioral Network, and the lowest overall rate in the Central Florida CARES Health System. And then for the highest female rate, again, we see that in the Southeast Florida Behavioral Network region, and the highest male rate also in that region. And so females have higher rates of past 30-day use compared to males in 3, 4, 5, 6 out of the 5 out of the 7 regions. And so you can see that males have a higher rate in a couple of regions. The Central Florida Behavioral Health Network and also the Central Florida CARES Health System. Just to sum up that previous slide there, boys were more, this should say, boys were more likely than girls, girls were more likely than boys to initiate marijuana use in 2018 for the past 30 days. Sorry, this is a little confusing. And then there was differences in the managing entities, with the highest rate in these 3 listed here. We'll talk briefly about synthetic marijuana use in Florida compared to the rest of the U.S. So we see this sharp decline in synthetic marijuana use. But first, the blue bar represents lifetime use among high school students, and the red bar represents past 30-day use, with the years listed on the horizontal axis and the rate listed on the vertical axis. And this is again state of Florida data. So starting in 2012, we see a 13% of high school students reporting lifetime synthetic marijuana use. And we've seen that drop sharply since then to the most recent year of 2018 with a 3.5% rate. So the trend perhaps is slowing, but it's gone so far down. There's only so much further to go, particularly in the past 30-day use, where 4.3% of high school students reported synthetic marijuana use in 2012, where that is now just 1.1% in 2018. And it's been at that rate in the 1% range since 2014, where you still see lifetime use decreasing a little bit in current years. Okay, next we'll talk about adult marijuana use, again with Florida compared to the rest of the country. The red line is going to represent the rest of the country, and Florida will represent, or the blue line will represent Florida. This slide looks at marijuana use in the past 30 days among adults from 2006 until the most recent year, 2017. Again, the Florida in the blue line, the data points there are on different intervals from the U.S. because we're combining 2 years of data. But we do see a trend upwards in both the U.S. and Florida. However, Florida's trend line has been below the rest of the U.S. trend line. So starting back in 2006, the U.S. had 6% of adults reporting past 30-day marijuana use, where in the most recent year, 2017, that rate is at 9.8%. And in Florida, that looked like starting at 5.4% and going up to 8.8%. However, I'd note the last few years here, despite Florida being lower than the national rate, you see a stronger trend line in the last couple of years of data from 7.7 to 8.8% in Florida. And this is also the same time period as Florida legalized medical marijuana. So perhaps you're seeing differences there. But that higher increase could lead to Florida having a higher rate than the rest of the U.S. in future years if that trend line continues. So to sum up, past 30-day marijuana use among adults increased progressively in Florida as well as the rest of the U.S. Since 2006. But adults in Florida were less likely to use marijuana in the past 30 days. Well, they're more likely to use, adults in Florida were more likely to use marijuana past 30 days compared to 2006. Now we're going to take a look at data on novel psychoactive substance use. We've seen low rates in the data sets in youth in 2018, and also we have data from the Florida medical examiners. So we don't actually have any charts on this, so the point is here that there are low rates of these specific drugs listed here in youth in 2018, and then tryptamine was only detected in 4 cases from the medical examiner's data. So I'm gonna move on to opioids now. So some of this is measured. We're going to take a look at the use of fentanyl analogs, non-medical use of opioids, and then also heroin use. So now we're going to, this slide shows the increase in fentanyl use among Florida residents from 2006 to 2017. So from the Florida Medical Examiner's report, and 2016 numbers are in the blue box, and 2017 numbers are in the red box. And so looking on the far left, the first set of boxes, the number of fentanyl analogs detected by medical examiners in Florida has sharply increased from 1,026 to 1,685. But then also increasing is the number of deaths that have been listed as, the number of drugs listed as causing death, fentanyl analogs. So again, a sharp increase from 965 in just 2016 to 2017 of 1,588. Move on to the next slide here. And this table shows non-medical opioid use with, so again, using data from medical examiners, the blue line represents the number of deaths where the drug, an opioid, has been detected, where the red line represents the percentage of deaths caused by the drug. So we see the percentage, the red line, increasing from 2013 to 2017, but from 2016 to 2017, you've seen a slight decline in that rate, from 72% to 71.2%. However, you've seen an increase from 2013 to 2017 every year in the number of deaths where opioids are detected, starting in 2013 of a number of 5,085. And in 2017, that number was 8,855, and you still saw an increase from 2016 until 2017. So to summarize, there's a big increase in fentanyl use in Florida, and a reduced rate of non-medical use of opioids from 2016 to 2017. So let's look at some of the specific drugs here. You'll see them all listed on the far right, and the bottom axis, the horizontal axis, is the years, where the vertical axis is the number of cases. So the black line is morphine, for example, and you see a sharp increase from 2013 to 2016, with a slight decline in 2017. Again, this is data from the medical examiner's report. You also see in the green line, going from a very relatively low number compared to other drugs in 2013 to the highest number in 2017 is fentanyl. So the number of cases in 2013, for example, was about 300. Where the number of cases in 2017 is over 2,000. And you've seen this, as many know, fentanyl jump up here compared to the other drugs, especially. So I just want to note that looking at the different groups of drugs, according to the medical examiner's report, there's rapid growth within high levels of recent use. And fentanyl, as I mentioned, had the quickest increase. Hydromorphone with the highest level and slow down in the increase. Then oxycodone with a high level, first to slow down in the increase among these three drugs listed here. 5 drugs have stayed relatively stable, and then 2 are low but increasing: buprenorphine and methadone. Now, I'm going to take a specific look here at fentanyl and morphine use in Florida, again, with data from medical examiners. So the blue bar will represent deaths with where opioids were detected, where the red bar is going to show the deaths that were determined to be caused by opioids. And the green bar is the percentage of deaths caused by the drug. So we will look here at all the drugs are listed at the bottom. So you see the highest deaths where the drug was detected in fentanyl, and also the fentanyl has the highest number of deaths that were determined to be caused by the specific opioid. And then morphine is second for both of those, so it's the second highest levels for both of those categories, with oxycodone next, as you can see. And then you also see the green line representing the percentage. Now we can see, again, looking at deaths with heroin, or where heroin is detected in the blue line, where the red line represents where it's been determined to have caused the death. We see sharp increases since 2013 in both of these categories, with it leveling off from 2016 to 2017, particularly in the red line, where deaths due to heroin was slightly lower than the previous year. In 2016 it was 952, where 2017 it was 944. Where the blue line shows still an increase from 2016, but a lower, not a sharp increase, with the most recent year, where heroin was detected and deaths at 1,057 cases. So it's very close to one another, as you can tell with this percentages from the past, that the deaths were determined to be caused by heroin. So, as I just mentioned, the number of deaths with heroin is moving at a lower rate than previously, where it was skyrocketing. And the number of deaths attributed to heroin use declined during the same 2016 to 2017 period. But however, both indicators remain at very high levels. And there's also, as I just mentioned, the very high rate of drugs attributed to the death, at nearly 90%. Great. So now I'm going to turn it over to Dr. Chen again to talk about cocaine use.
Thank you, Mike. Did a great job. I just want to kind of emphasize a few points from the Mike's talk. First, I want to say the data from medical examiners are objective. They are not affected by self-report. So even though we do not have data just for adolescents, but this data are provide a very important background information for us. Secondly, I want to see emphasize that the opium use, number of deaths detected with opium and the deaths caused by opium, they are very close. That means, the opiates is really like a killing drug. Like more than 90%, if they try and drug it, they caused by the drug. And that is something which we need to I need to emphasize. So this is what we want to say from the information to see how bad is the drug. So the percentage of deaths caused by the drug give us information how bad is the drug. Now I'm going to go over with you about a couple other drugs we evaluated using data from medical examiner report, and also some other survey data to give you a full picture of the substance use. Now we're moving to the so-called hardcore drugs. We'll start with cocaine, and then we're going to do a national comparison as usual, so for you guys to know how good how we are compared with the nation. We'll also look into the age, gender, and the school grade differences. This first slide shows about the use in the past year. You can see we changed the indicators, because if you use past 30 days, we may not get the people. So for cocaine use, and this is not all the safety covered, but National Center on Drug Use and Health did have asked the question. So they asked for past year, the change in the definition of the use. So the vertical axis will be the rate, which from 0 to 1.8%, and the horizontal axis will be the time. And here the same thing, like for the blue line will be for Florida, the red line for the national average. And the same is like the Florida data is between the national, because we use a 2-year average. Overall, the trends, like you feel, since the number are so small, if you feel about the decimal thing, they are very much similar across the nation. The fluctuation could be even due to sampling errors. And the earlier project at 206, 207, Florida did have a higher rate of 1.7 compared with the national in about 1.5. But by the end of 2016, 2017, and you see the 2.9, even though both point is 0.05 or 0.05% for both the nation and Florida. This is because of the decimal point. So you see the national will be 0.5 something, and the Florida is 0.46. So round up like a 0.5. So anyway, the cocaine use in Florida, among Florida use actually is like a keep it decline, which is a very good sign. Thank you for all the people who work in the field, or the state, the association, the state, to bring this drug down. Next, we want to give more details regarding. So now we change it to lifetime use. The lifetime use will get bigger numbers. So to make the to compare the demographics and the school grades to see how it goes in Florida from 2010 till 2018 in the past 80 years. And we have so many lines in the chart, like in first two slides we see before. So the top line will be for high school students. The bottom line will be for middle school students. But the more that show a similar pattern with like a bigger drop for high school students from 2016 to 2018, the decline from 2.5 to 1.9, which is a very dramatic change. And the overall, the black line in the middle shows the statewide trend over the time. We have a quick decline from 2010 to 2014, then slow down from 2014 to 2016, and we speed up again, from 2016 to 2018. Could be due to the big drop in high school students from 2.5 to 1.9, and also the bigger drop in. This is I think the main difference will be there. Also, like a quick decline in the green line from 1.6 to 1.3 for girls during this period. This is the breaking down by the school grade and the gender to give us more information about the changes in cocaine among adolescents in the States. This is just like a summary about the historical trend in Florida, similar to the nation in terms of cocaine use among adolescents. So current level still remain at very low level, which is good, but we have to check. Do not allow them to come back again. Certainly we have a gender difference. Boys are more likely to use this kind of hardcore drugs than girls. Okay, well next we'll move to the compare the difference of cocaine use by the managed entity regions with data from the Florida Florida Youth Substance Abuse Surveys for use from age 11 to 18 in 2018, the most recent data. From here, statewide, the rate is very low. Statewide, the left bar, the most left bar, the brown bar, show 0.4% of use in 2018 reported use of cocaine in the past 30 days. With boys higher than girls, 0.5 versus 0.4%. We do also see bigger region, managed entity region differences with like a several region with 0.5 on the statewide, like a 1, 2, 3, with 4 regions with a 0.5% rate, and also there's with like one with 0.02, the Central Florida care health system with 0.2%, which is like half of the state average. And we also have kids in BBHC reported no cocaine use in the past 30 days. They may use in lifetime, but may not use in the past 30 days. And we also see different gender patterns. State overall, like boys are more like it than girls too. But if you see Southeast Florida up here, the last 3 bars, you can see the girls like with 0.7% with boys only 0.3%. So it's a reverse pattern. And this is the many region differences. We also have a summary for us to get the meaning of the slides we showed before. So we see large variations in adolescent cocaine use based on our own survey data. And we also see no adolescent in Broward reported past 30-day cocaine use. And we do have a higher rate of cocaine use in 4 states, as already mentioned here, Big Bend, the North Rim, and South Florida, and Southeast Florida. That's more, I believe this information will be very useful for you guys to think about how to reduce cocaine use among adolescents. Okay, next we're going to be asking this kind of hardcore drug. It's very hard to get a good data from survey. Now we talk about the data from medical examiner reporting about among those who's deceased, and then we check their body to see if we find a cocaine in the number of persons deaths due to the cocaine. So now we have data for the in 5 years, 2013, 14, 15, 16, and 17. In this way, the vertical axis on the left side will be the number of deaths. The blue bar is the number of deaths with the cocaine detected, and the red bar is the deaths because of cocaine use. And the brown line on the top is the percentage caused by cocaine use. And the overall can see this is the blue bar indicates a continued increase in cocaine use among deceased person in Florida. Correspondingly, the deaths caused by cocaine also increased. With the percentage of deaths caused increased by percentage of deaths caused by cocaine also increased. So in way, it seems like now people more abused cocaine than before. So more deaths were caused by abuse of cocaine than previous years. In 2017, the percentage comes down to 64.3. And so this is even though the speed seems like a slow down a bit about the percentage time, but this is a big issue. So in a way, we summarize 3 things on the top. So from 2014 to 15, we have a 10% increase in all these measures, but from 2015 to 2016, the rate increased to 16.5%. Fortunately, there's a slowdown from 2016 to 2017. The increase rate only about 4.7%, less than 5%. And you may recall the percentage of deaths caused by the drug for cocaine. If you recall the fentanyl and other drugs, those are about 90%. So those drugs are more worse than the cocaine in terms of cause people to die because of abuse. That is something we can put on our mind. Now we break down the trend by managed entity regions. The chart is kind of crowded, but we have that many regions, and we need to be patient to read this chart. Since on the vertical line will be number of persons checked with the cocaine, and the horizontal axis will be the year, and overall, the whole period is 9 up and down. I recommend you to look at the chart from 2013 to 2017. So for this part, which is most recent, we see how the things are changing over time. And the top line will be Central Florida pay. The line on the top will be Central Florida health network system with highest level also not the quickest increase, but very high level continued increase in cocaine detected from the deceased persons. The second one is the green line, which is Lutheran, and the increase with the quick. Started with low in 2013, relatively low in the middle, but increase very quick, particularly from 2016 to 2017. And the dark brown line, and even though increase for dark browns for Southeast Florida, even though increase very sharply since 2013, but there's a slowing down in the speed of increase. And for the next green line will be the South Florida Behavioral Health Network. They showed a declining trend. Yeah, I believe this region did a not good sense to bring down the increase trend from bring the increase trend from going up to down, which is I believe it's not easy. We need to see what we have done over there. The next dark green will be for Central Florida Care Health System, which continue increase from 2015 all the way. Is no change in the trend of increase. And the next, like yellow brown will be for BVHC, which also Southeast Florida, also brings the rate down from 2016 to 2017. And the last one, CBC, which lower level also going down, which is like a model for all their managing entity regions. And this data I think is very informative for all of us to know. We did have a summary for this, cocaine use from medical examiners data. Both the number of deaths and the deaths caused by the drug increase. Overall increase from 2017 to 2017, and we do see bigger managed entity region differences in detecting these drugs. 3 managed entity regions with highest level and the fast rate of increase will be Central Florida Care, and Lutheran. One region was the north, the bigger the line at the bottom, with no increase, no rate but no increase. Okay. Now we'll move to methamphetamine use. So I'm going to use about 2 pieces of data. One is from the Florida Youth Substance Abuse Survey. Another one is from the medical examiner's report. Here's the lifetime use of methamphetamine in Florida and the possibility use with data from the Florida Youth Substance Abuse Survey. So the blue line will show the lifetime rate of use. The red line shows the possibility use. So you can see the rate of use from self-report is very low, both lifetime and the possibility days. Overall, in 2018, the rate is for lifetime only 0.7%, and possibility 0.4%. If you go back to 2006, both rates are much higher. For lifetime, it's 2.1%, like a 3 times reduction from 2.1 to 0.7, and the possibility from 0.7 to 0.4, like a half. So in a way, people may suspect about this, the data we have. Yeah, so that's just a summary about the previous slides. I'm going to show you more about the data from medical examiners, which may give us concrete but indirect evidence about methamphetamine use among people in Florida. Here's the data from medical examiners starting 2013 and 2017 new data will be available maybe in half a year, something like that. So here you can see we have two axes. The vertical axis is the number of deaths, and the right hand, the vertical axis percentage of deaths caused by the drug, and the blue line is the number of people with the drug detected. The red line is the deaths caused by the drug. So this is a big change in all the three indicators, and the person detected with the drug actually increased. The blue line actually increased, very quick from 169 in 2013 to 858 in 2017. And the increase rate, based on the chart, the increase rate from 2016 to 2017 slowed down a bit, and the quickest increase will be from 2015 to 2016. And the reflected is the total number of persons detected with the drug, methamphetamine. The deaths also follow the same trend, with the percentage of deaths caused by the drug also show increased trend, starting with 46.7 in 2013. Now we have 54.1 in 2017. This percentage deaths caused by the drug indicate could be the drug is more potent. People abuse more, more amount. There's something we have to think about, not just the total number of count, but the way people use the drug. So if either the increase of the potency of the medicine or the drug, or people use more abuse, more wrong way, overdose. So this is just a recap of the previous slide talk about a rapid increase in deaths detected with the drug, and also increase in deaths attributed to the drug. And from this data, you can see the data from that's a report could be, as a question mark. Since there's an increase in adult exposure, we suspect, the reduction in use, particularly low enough in adolescents, could be something we need to pay attention to in the future work. All right, we didn't go that far. Right, yeah. Now we'll move gears to talk about medical use of benzodiazepines. Hold on. It's done. Yes. So we know, as many of you even may know more than me about the benzodiazepines, which is for treatment of anxiety or depression, not feel happy, and they make it calm down. And we do see relatively benzodiazepines doesn't like it to cause people to die, but people more commonly use. So also, you cannot buy this, you have to do a prescription by doctor to use them. And then we're going to show you a few data for this drug. Here's the data from the medical examiner's report of the persons detected with the drug, also caused by the drug. So the same chart like before, the vertical line will be number of deaths on the left side, the right side will be percentage caused by the deaths. The bottom will be the data by year. So the orange bar is the percentage of deaths caused by the drug. It says 25, 27, 24, 27, 27. Relatively stable. The percentage is much lower, not like a 90% or 50%. So that's negative cause deaths. And the blue line will be the number of the people who died and detected with the drug. And the red line will be the number of persons, the deaths due to the overuse, the overdosage of benzodiazepines. This also give us an impression that even for sleeping pills, but still can cause people to die. Since there are so many, the benzodiazepines, we provided like a pie chart to see what type of benzodiazepines are most found most often in the deceased person among Florida residents. From this chart, we list 10, commonly used benzodiazepines, with alprazolam the most commonly used on the darker green pie in the pie chart, and the one on the top on the right hand of the list. The second, most commonly is the nordiazepam, which is in our chart is 13%. Alprazolam is 37%. The third is diazepam, which is about 2%. You may know the nordiazepam and the diazepam, they are related. When you take the diazepam into your body, they have to remove a chemical group, become nordiazepam, which is more effective. You can see how people make their choice using drugs, and so these three are the most commonly used for drugs. Since for drug use prevention, we are not focusing on each person, we are focusing on the whole population. So we need to catch the most commonly used drugs in order to reduce the impact of the drug. Okay, this is just a summary of the pie chart first to catch the most important things. Alprazolam will be the number one, almost more than I said. The next two will be diazepams, which are either no or not. There's two drugs we need to prescriptive medicine we need to put our mind, plan our work, and change our strategies. So this two diazepam and alprazolam are most common. We further analyze this data for these two sleeping pills or benzodiazepines to see how they change in between 2016 and 2017. So in this table, the left hand we see the state total and also by managed entity regions, and the first three columns of the data will be for alprazolam. The last three will be for diazepam. So you can say statewide, we have 1,851 person detected with the alprazolam. This number increased to 1,889 in 2017. It would increase 2% statewide. But for diazepam, and we detected 664 in 2016, but in 2017 we only detected 607. That's an 8.6% decline. This is statewide trend. So anyway, people move to alprazolam, which is the number one, 37% of the this is we detect with the drug, and the diazepam is the reduction. Maybe they move to the north diazepam, so that is something which we can see. And by the managed entity regions, we do see difference across the board. We have 15%, more than 50% decline for BBCBC, and but we have 15% increase in Northram, and there is we need to watch out. And this is for the alprazolam. For diazepam and the by region, we see bigger reduction as the BBCBC seems to do something very good to reduce this drug, 42.9% in BBCBC. But we do see increase in some other regions, almost 3.9% for Central Florida behavioral, and which is kind of high. So this is the picture of the change in the two specific benzodiazepines in across many regions, overall and across regions. So we need to watch the alprazolam abuse, the prescribed use, and the less pay attention to diazepam, but pay more attention to nordiazepam when you do your provide your service and talk with people in the community. Okay, this is just a summary of the previous slides regarding the prescriptive sleeping pills use. So we have the 4 managing region with a decline trend, particularly in big band, and with 50%, 3.3% decline. Well, 4 with the increasing trend, particularly in Southeast Florida. Let's talk about alprazolam, which is the most commonly used prescriptive benzodiazepines. With regarding to diazepams, during the same period, steroids is the increased trend, but Swain managing entity with the increased trend, but with the whole 4 with the decline trend, which to me is we need to pay attention to. Okay, this is about all the substance we're gonna we covered for today's webinar. Now I'm to give you an overall quick summary with one slide, also mention a few challenges we need to face. We do overall from the whole presentation, we do see a lot of cross-managed region differences. I see the differences we for potential to improve, not say somebody doing good or bad, because if somebody can do better, we should learn from them. And so this, for me, I see the differences as an opportunity. And I think the following 4 things we need to put on mind will be challenges we need to try to solve. We need to increase our effort to prevent e-cigarettes and marijuana use among adolescents, which is it's on the increase band. Secondly, we need to think about how to prevent girls from trying the use of alcohol and marijuana. In the time when attendee asked me questions, say, is the alcohol use gender differences the same like before? We need to check in that part. And much effort needed to curb the increase in opioid use, particularly heroin and fentanyl analogs. This is a bigger challenge for us. We need to pay attention to. The last one is how to reduce the cross-region difference in benzodiazepine use. For some increase, some decline, some higher, some low. That is something which we need to pay attention to. With this, we'll conclude the webinar presentation. The reference list that we use for the talk, we are including the webinar for anybody. If you have interest, you can take a look. Now we still have 5 minutes for question and answers, if you have any. Hello.
Thank you, Dr. Chen and Mike, for the great presentation. And does anyone have a question? If not, if you have questions, we will be emailing Dr. Chen, and he will respond. So if you have any questions, please go ahead and post them, and then I will capture them and send them on to Dr. Chen.
Yeah, you can send a question to Diane later if she can pass to me if you want like a challenge question, which we cannot answer right away.
Okay, everyone. When I conclude today's.
Thank you. Bye-bye.
Thank you. When I conclude today's webinar, your browser will take you to an evaluation on FADA's new website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FADA's system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be Messenger at WebEx. Evaluation will close at midnight on Thursday, March 21st. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd also like to recognize and thank especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation.